Welcome to Hard Talk. I'm Stephen Sackur. Much of the world responded to the COVID-19 pandemic with a lockdown strategy. Now, the focus is on finding a way out of lockdown without prompting a second wave of infection. Could Sweden provide a model? Well, my guest today is Sweden's chief epidemiologist, Anders Tegnell. Now, he was the architect of a controversial no-lockdown strategy, which continues to stir interest right across the world. Has it worked? Anders Tegnell in Stockholm, welcome to Hard Talk.
Thank you.
Let's begin with the latest picture in Sweden. Your death figures every day from COVID-19, they go up, they go down, sometimes by quite significant margins. It's hard to get a real sense of whether you are really in control of the spread of COVID-19 in Sweden or not. What do you say?
Yeah, we know that the death toll is a bit complicated to follow because the registration of deaths is sometimes a few days late. So what we do is that we now collect data on actual date of death. And we do it in that way that we don't look too much at the last 10 days because we know they are very unsure. A lot of things happening and they fill out every day. Instead, we look at the days before that and then we can follow the trend much better. And we have a very clear declining trend. I think we topped just under 100 cases a day, and now we are down to slightly more than 80 a day on the average. And the trend seems to be keep going that way. And
that trend is clearly very good news, yeah. But is not the brutal truth that you have had many more deaths in Sweden than you would have had if, like your Scandinavian neighbours, you had imposed an early and very strict lockdown policy?
I think that's very difficult to know. I mean, the death toll in Sweden is mainly in the long-term facilities for long-term ill elderly people. And we had very much an unfortunate spread in those facilities in a way that some other countries had, but not our Nordic neighbors. And why we had a spread in Sweden and not in our other neighboring countries, that's something we're trying to investigate now.
But with respect, Dr. Tegnell, isn't that part of my point, that you probably would not have had that catastrophic spread of COVID-19 through your care homes, particularly around Stockholm, if you had run a more strict, a less open policy for the general population?
Yeah, I mean, these people meet a lot of people, even if you have a lockdown. So you can't isolate them. So in that way, a lockdown would not have stopped the spread into them. And we can see now when we are starting to look at these places, we see a decline in the incidence in those places once we start really focusing and getting them to focus on basic hygiene procedures and so on.
Let me ask you this. As the country's chief epidemiologist, the man, let us be honest, the man who in many ways is the architect of the Swedish government's strategy for coping with COVID-19, can you regard a situation in which your country has getting on for 30,000 infections of COVID-19 in the population, has a death toll which is significantly higher than your neighbours, standing at around 3,500. Can you regard that as success, or do you have to acknowledge that in some ways your strategy failed?
Yeah, no, that's true. When it comes to the death toll, this didn't work out the way we hoped it. On the other hand, I mean, the connection between our basic strategy in slowing down the spread, if that really in the long run will affect the total death toll in a society or not, that is not clear yet. I mean, we know that our neighboring countries by now have around 1% of the population who had some kind of immunity has had the disease. The investigations we have had in Sweden so far, we have a major one going on, will give us a better answer. Points to it, we have at least 10, maybe 20 times higher level of immunity in the population, which means that we are much further into the spread than our other countries. And if that would mean that the other countries will reach similar death tolls to us or not, I think that's very difficult to judge.
That is a very interesting answer, because you're inviting me there to consider the long-term significance of this notion, this concept of herd immunity. Now, your own government says that the strategy that you implemented, the more moderate, the less strict emergency response to COVID-19, was not about establishing herd immunity. But you seem to be suggesting that actually it is about getting to that point where so many people in the general population have had COVID-19 and therefore we can assume have some resistance to getting it again, that you have this concept of herd immunity in your population. Was that the working strategy or not?
No, it was not. I'm just pointing out one way that shows that you cannot make this kind of easy comparisons at this stage, because the epidemic has hit different countries in many different ways.
The point is really about comparisons with your Nordic Scandinavian neighbours, because they took a very different approach. They were much stricter in their lockdowns, as you've acknowledged. And the death tolls, well, Denmark just over 500, Finland just over 200, Norway just over 200. They are strikingly different from Sweden's. And the point really is that they now feel that they're in a position to ease their strict lockdowns, to bring some sense of normality back to their populations. And to quote one of the senior ministers in Denmark, they feel that there's very little chance of a second spike in infections because of what they've achieved. So they're as far along the curve as you are, but they've prevented hundreds and hundreds of deaths that you failed to prevent.
But I don't really understand what you mean that they're as far along the curve as we are. Obviously they are not. If only like 1 or 2% of the population has been infected, they are not very far along any kind of curve.
But they're very confident that because of the measures that they took and the social distancing and the public consciousness that they now have, that the disease will not spread and will not kill the numbers that have been killed in Sweden.
Yeah, and only the future can tell. If we look at other kind of similar kind of diseases, we have never really been able to stop anything. We can sometimes delay things, like they have been very successful in doing in our Nordic neighbors. But to stop them forever, I don't think that's going to be possible with COVID-19, just as well as never been possible with flus or any other kind of viral diseases in this way.
We'll come back to your vision of the future in a moment, but I am very interested in the more philosophical point that your approach has tested, and that is the notion of not conducting your emergency response through the heavy hand of government, through strict mandatory lockdown, but talking to your people, placing trust in your own population and saying to them, we are relying on you voluntarily to adopt behaviours that we think will best control the spread of this disease. Do you think your policy of trust has worked?
Yes, I really do, because we can really see that we have big impacts, and that comes back a bit to the comparison to other countries and so on. If we look at some of the statistics that we have, we can look at the travel patterns. Travel during Easter in Sweden was only 10% of normal Easter, showing that people really try to minimize the social contacts. We can also see that some of our other viral diseases, like flu and so on, which has the same kind of pattern every year, suddenly stopped in the middle of that pattern and disappeared. Also, once again, showing that social distancing really worked. And you can see trains in Sweden runs at 10% of the capacity. Domestic flights are almost not running anymore.
So if we take the logic of
people
this...
really took this on,
right, so
in a way that probably is more or less equal to countries who did it by illegal measures.
Indeed. Yours was not a mandatory crackdown. So in that sense, do you think that some governments, particularly in Europe, where the lockdowns have been very severe, have infantilized their populations, and therefore when they release the brakes, people may not act in the responsible way that you say Swedes continue to act?
I don't know if I can judge that, but I can say one very important thing for us is what you are alluding to, and that's sustainability. This kind of measures, voluntary measures, with a big understanding in the population why we're doing things, have a much higher level of sustainability. And we all know that this is something that we're going to have to handle for a long time. And as you said, our Nordic neighbors now believe that they can handle it in a long time, going over to something which is fairly similar to what Sweden is doing today. But we really need to then have sustainable solutions. And sure, I mean, there's signs of a reaction in some countries that when you turn things free, then you really use your freedom to a maximum extent. Here in Sweden, even if people are getting slightly more mobile and so on now when we're heading towards summer, we still have a great level of social distancing in place.
Let me, if I may, get a little bit personal with you. I said earlier you became seen as the sort of architect of a maverick policy which went against the grain of the scientific consensus in many other parts of the world where scientists were backing very strict mandatory lockdown. It did put you in the spotlight, not just in Sweden, but right around the world. And as the death toll has mounted in Sweden, and you've been very open about that, how has that affected you personally? Do you feel any sense of personal responsibility for those lives lost?
I mean, this is not my decision or anything like that. We are a big agency. I have my director who backs this whole thing.
Yeah, but you're a modest man, but I think you would accept that much of the groundwork and the strategy and the thinking behind Sweden's policy came from you. And it does seem to me that that's quite a burden for you to bear when we see what has happened.
I mean, of course, this death toll is highly regrettable, and it's a terrible thing that we're seeing. I think we have a number of explanations why this happened, not directly connected to our strategy. Now, when we're investigating these long-term facilities, where there obviously is a lot of things that can be done to improve the quality of hygiene and other things there, and most likely would diminish the death toll over time in those facilities. It's highly regrettable that that was not seen by the people responsible before this happened, but it did happen. And of course, it's terrible. On the other hand, we are not too sure a strict lockdown would have changed so much. It didn't change very much in the Netherlands, in the UK, and many other places.
And what about the debate in the scientific community? It's very notable that, you know, I think it was pretty much 2,000 scientists, doctors, professors, learned people signed a petition calling on the government to reverse your policy and impose stricter measures. That was back in late March. And then even in April, on the 22nd of April, some very respected scientists in Sweden wrote a piece condemning, quote, officials without talent, which undoubtedly included you, saying that the decisions were wrong. And to quote one leading immunologist, Cecilia Söderberg-Nyckler, she said, "We are not testing, we're not tracking, and the people behind this strategy are leading us to catastrophe." How did you cope with all that?
Yeah, I can cope with all that because I know that of the other 40,000 scientists in Sweden, the majority is really behind us. We have an expert group that we talk to every week who are very much behind us, completely in line with what we're trying to do. And we are really trying to do the best we can under the circumstances we're in. That we are trying to sacrifice somebody to have an easier burden on the economy is definitely false. The 2,000 was a big mixture of different kind of scientists, and the smaller group of 22 is not our leading scientist in the field. The leading scientist in the field is behind us.
What about the public?
That part doesn't worry me too much. I mean, the death toll definitely worries me, but that small group of scientists does not worry me too much.
Interesting. And what about the public? Because the public's been split too. You've had a lot of support. You've had people even putting tattoos of your own face on their bodies and wearing T-shirts proclaiming their support for you. But you've had others, and I dare say some of those were the family members of people who've died, who have been very critical. That's tough.
Yeah. But I think that also shows that the agency and the policy has a strong support in the population. We have done several investigations, and not only us, many others have done investigations. And the level of people who are behind what we are doing is like 70-80%, which is an incredibly high number for any kind of measure from a public health agency in Sweden. And only like 5-10% thinks that we should think more about the health of the population. Another 10-20% are worried about the economy. So, and I think that's is a great support for what we are doing, that the population is definitely behind us. And then we have some extremes with tattoos and stuff like that, which I try not to think too much about.
Well, it must be a strange feeling when you see yourself on somebody else's body, I can imagine. But you say that you didn't do any of this in terms of the strategy and the policy that you scientists came up with and that the government adopted. You didn't do it for economic reasons. But surely the truth is that when it came to the crunch and making these big decisions, people at the top of government in Sweden did want to keep the economy functioning as well as it possibly could. They wanted to avoid long-term damage, and surely that was a very important element in this strategy.
Not the way we delivered it. I mean, we didn't do those calculations. On the other hand, we did calculations on the broader public health impact. I mean, when it comes to closing schools, there's a lot of science behind that closing schools does a lot of damage to children, especially children who are vulnerable already from the beginning. Being out of work is also very dangerous from a public health perspective. So I think you're onto something here. I mean, our strategy includes a broader public health perspective than maybe many others in other countries. When it comes to the economic consequences, that's on the government level, and of course they will make the adjustments to the things we suggest, taking economy into account, but it's definitely not our part of the development of this strategy.
Right, so when you look across Europe and the world at other countries and the way they're doing things, and I'm thinking now where I am, the United Kingdom, where the lockdown is still pretty much in place with a very few minor easings of it, and schools are still closed, and there's a very great debate about whether any schools beyond primary age will open before September. It seems they won't. Are you saying that is just plain wrong? It is a mistake. It's getting the balance between tackling COVID and wider public health and social issues. It's getting the balance wrong.
Yeah, I mean, only the future can tell. And I think that what is the science behind this and what is not the science behind the dealings with COVID-19 is definitely not clear. I mean, not anybody can claim that they have the science that lockdowns are good and the more open strategy in Sweden is wrong, because there is no science really supporting anything. I mean, what's supporting what we're doing in Sweden is that we are following a long tradition on how we work in public health. We are also taking into account that public health effects of closing schools and other things would give you a lot of long-term problems in the area of public health, and that needs to be taken into account when you close schools and so on. Not doing that, I think, would not be ethical and not be a correct public health way of working.
I'll tell you what's striking in this interview, and I would say honest on your part, is that you keep telling me that, you know, on many aspects of this COVID-19 response, the science isn't clear. I want to, in that context, bring you back to the notion of herd immunity, because you have said, you said it just a few weeks ago, that you believe by the end of May that there will be a form of herd immunity in play in Stockholm. I think you suggested that by then you could imagine that maybe 30 or even 40% of the population will have had COVID-19 and will have therefore a form of immunity. But it seems to me you have no scientific evidence for that. You're not doing enough testing to know whether that 40% figure is real. And you also, frankly, don't know the science of COVID-19. You don't know that having had COVID-19 gives you any long-term immunity at all. So where's your science?
We are just now doing a major investigation in Sweden, like they've done in other countries, taking a sample of the total population and looking at the level of immunity they're having right now. So we get better data. What we are basing it so far is a few minor investigations showing levels between 10-15% of different smaller groups have immunity, which supports the modeling that's been done by 2-3 different scientists in Sweden. And when it comes to immunity, I just recently had a discussion with the top scientist on coronavirus and immunity in Sweden. And everybody says, of course there is immunity. We can measure antibodies, we can measure other aspects of immunity. And why should COVID-19 be different than all other infectious diseases?
But what about these cases, Dr. Tegnell, what about these cases I read about from China to California of people who had COVID-19, recovered, tested negative after they recovered, and then 2 months later test positive again? Apparently they've caught it again.
That is not a reinfection. I mean, some of them, I just discussed this with the top people in Sweden who have looked at those. Some of them is what they call a recurrence. I mean, you can have parts of this virus and carry it obviously for a very long time, which explains some of the cases. Other cases were obvious contaminations when they were tested the first time. There is no, as far as they knew, and I really trust these people, there is no confirmed cases of somebody really had the infection twice. We have a very good system of registry in Sweden. Among all the cases we have had in Sweden, not one of them had it more than once.
Well, to be really sure then about how much immunity there is in the general population, you do need the antibody test. Roche, the pharmaceutical giant in Switzerland, has now developed an antibody test that the US, the EU, and now the UK governments are all saying they approve of. Is Sweden intending to test pretty much everybody over the next few months?
We are doing, as I said, we are doing a test of a sample of the population to look at the level of immunity in the whole population right now. The samples have been tested, a few of them have been run, but in the next week we'll be able to tell what's the level of immunity. And we're using a number of different methods to look at that, because there's a number of methods out there, and we have developed some of ourselves. With the help of the top immunologists in Sweden doing this. So towards the end of next week we can say better what level of immunity we have in the population. And these kind of tests will be very important.
We're short of time, Dr. Tegnell. I'm sorry to interrupt. We're short of time. I just want to end with some thoughts about the future, because throughout this interview you've indicated you don't think that if we can call it the fight against COVID-19 will come to any sort of end until there is an effective vaccine that is deliverable to the world's population. So we're talking, let's say, a year, 18 months at the best, in most people's view. In the meantime, how much normality can there be? If we take Sweden as one of the more advanced countries that's thought about this a lot, do you think that we, for example, can return, before a vaccine, to a world in which there is widespread travel, even between countries, where crowds can gather at music concerts or football stadiums, where hugs and handshakes can become routine again, where people do not have to wear face masks on public transport? Or has our life fundamentally changed for the long term?
Nobody knows the answer to that question. I think certain things we can be quite sure about. I think for a long time we're going to need to protect our elderly in different ways, because they are always going to be susceptible to this disease, and they're always going to have a very high death toll to it, unless we find a vaccine that will work in that part of the population, which is not going to be easy, or a treatment, and that's not going to be easy either. When it comes to other things, this is not only one nation that can decide about travel and so on. I think that we in Sweden would feel rather confident to ease down on some of the things. Maybe traveling around could be okay. Maybe a few other things could be okay. If we sometime get immunity tests that works a bit better on the individual level, which they unfortunately don't do yet, we don't have enough experience on that, we can probably ease a few other things too. Our main concern now is really the elderly, who have been very isolated, and we need to find different ways of easing that isolation, because that will also affect their health, both in the short term and the long term. And I think that's one of our main concerns right now.
And I'm just very interested in one point. Do you go out, every time you go out now, do you wear a face mask?
Nope, in Sweden we don't wear face masks. In Sweden we stay home when we're sick. I think that makes a big difference.
Anders Tegnell, it has been fascinating getting your insights from Sweden. Thank you very much for being on Hard Talk.
Thank you.